Today on the Trey Hart channel, I'll be talking about vitamin C. Stick around. Welcome to the Trey Hart channel. I am Ray Upchurch, your host. This is the fifth part of the Essential Vitamin and Mineral series. Vitamin C is also known as L-ascorbic acid. Unlike the fat-soluble vitamins we have so far been discussing, vitamin C is a water-soluble vitamin. What this means is that unlike the fat-soluble vitamins, they can dissolve in water and are carried to the body tissues but are not stored in the body. This also means that they need to be replaced faster than fat-soluble vitamins, and if you consume more of the water-soluble vitamins than you need, then it is excreted instead of being stored. So vitamin C is required for the production of complex molecules such as collagen, L-carnitine, and certain neurotransmitters. Vitamin C serves as a key antioxidant. It strengthens blood vessel walls, it helps prevent atherosclerosis, it promotes wound healing, and supports immunity. So, what are the symptoms of vitamin C deficit? Well, if you're a fan of pirate films, then you may have heard of the term scurvy. Scurvy is what you get when you do not have adequate vitamin C. The symptoms of scurvy include fatigue, malaise, inflammation of the gums, and if vitamin C deficiency is allowed to progress, then the collagen synthesis becomes impaired. This causes a connective tissue to become weakened, and additional signs of scurvy may include swollen, bleeding gums, and loosening or loss of teeth. In children, bone disease is present, and if left untreated, scurvy is fatal. The groups most at risk of vitamin C deficiency include smokers and passive smokers, as a result of the increased oxidative stress from the smokers. Infants that are fed evaporated or boiled milk are also at risk. It should be noted that both breastfed and formula-fed infants will receive adequate amounts of vitamin C in their diet. Also, those at risk are individuals with limited food variety, which sometimes includes elderly, indigent individuals, people who abuse alcohol or drugs, people with mental illnesses, and occasionally children. And lastly, those at risk are people with malabsorption or certain chronic diseases, as they are simply unable to absorb the amounts of vitamin C that they need to. The recommended daily allowance of vitamin C in babies between 0 to 12 months has not been established, as it is considered that they are either breastfed or formula fed and already have an adequate intake, which is between 40 milligrams and 50 milligrams. So the recommended intake starts when you're a child. Between 1 to 3 years old, it is 15 milligrams, and for children 4 to 8 years old, it is 25 milligrams. From 9 to 13 years old, it is 45 milligrams, and for adolescents between 14 and 18, it is 75 milligrams for males and 65 milligrams for females, unless they are pregnant. Then it is 80 milligrams if they are pregnant, or if they're lactating, it's 120 milligrams. Finally, for individuals that are 19 and older, it's 90 milligrams for males and 75 for females, which goes up to 85 if they are pregnant and 120 milligrams if they are lactating. Okay, I know this is a lot of information, and you may be wondering, how do you get your vitamin C? Fortunately, vitamin C is in many fruits and vegetables. An example of these would be guavas with 628% the daily value per cup, bell peppers at 317% per cup, kiwi fruit at 278%, strawberries at 163%, oranges at 160%, papaya at 147%, broccoli at 135%, tomatoes at 91%, and snow peas at 63%, and finally kale at 32% per fresh cup. Now these are a few examples of fruits and vegetables that contain vitamin C. Now you may be asking, are there any health risks from excessive vitamin C? Well, fortunately, vitamin C has a low toxicity level and is not believed to cause serious effects at high intake. However, if you remember earlier, I told you that water solubles are excreted if taken in excess. This is what happens when you take too much vitamin C. The most common complaints are diarrhea, nausea, abdominal complaints, and other gastrointestinal disturbances. So this concludes a brief discussion of vitamin C. How do you get your vitamin C? Let me know in the comments section below. If you have missed any of the essential vitamins and minerals, go to www.treyhart.com and see the others. If you like this content, I would appreciate it that you would press the like button below. If you're not a current subscriber, please subscribe. Remember, your health is your wealth, and you are worth it. I will see you next time. Bye for now.